our first case is a 26-year-old engineering student who presented to the hospital with complaints of fever for 12 days duration. 12 days duration. The patient was on tour to the Himalayas when his symptoms started. Fever was low grade with no associated chills or rigors. In the first 2 days of fever, he also had loose stools for 2 days, which subsided without any treatment. So as fever was persisting, he was treated with cefixime 200 milligrams for 3 days, and there was no relief of symptoms. He did not have any significant comorbidities. He did not report any addictions. There's no high-risk sexual contact. The patient has been consuming food from the local dabas during his entire journey. So that is how he's presented, fever of 12 weeks. To begin, he had some loose stools as well, no other localizing. On examination, he was conscious and oriented. He was well. His temperature was 101. Heart rate was 80. Her BP was 120/80 and respiratory rate was 14 per minute, which means that the patient is stable. Okay, and there was no lymphadenopathy. The abdomen, there was no palpable liver or spleen. Respiratory system, there was normal vesicular breath sound, there was no added sounds, no crepitations, no wheeze. Cardiovascular system, normal heart sounds, no murmurs. Okay, then we did the basic investigations. So his total leukocyte count was 8,600, neutrophil 61%, lymphocyte 30, eosinophil 0, platelet count 1.51 lakhs, something like a low normal, hemoglobin is normal, MCV is okay, hematocrit is okay, ESR is 33, CRP is mildly raised, like 12, malarial antigen is negative, bilirubin total 1.1, bilirubin direct is 0.2, okay, fine, normal. But you have mild elevation in the transaminase levels, ALT and AST are mildly elevated, 89 and 67. Blood urea is 21, creatinine is 1.1. So what do we have here? We have a young patient who has been on a long trip to northern India, presenting with complaints of a prolonged fever. So how do you call it as prolonged fever? There is no definition of prolonged fever as such. But again, like the fever lasts more than maybe a week, you can call it as prolonged week. It's not a standard definition, just for the practical purposes. And then he had diarrhea in the presentation, but diarrhea is not there as of now. He just has fever. And on evaluation, like physical examination, we couldn't find much. Except for that, during the fever time also, his heart rate is not much elevated. Something called as relative bradycardia. That may be a clue, may not be a clue. Okay, not very sensitive or specific for him. And then again, investigations, when you come, most of it is normal, the total count is normal, the platelet count is low normal, and there is mild transaminitis alone. So this is how most patients present to us with prolonged fever. So what all differentials will you keep? Before you go, the X-ray is also provided. So look at the X-ray, do you see any abnormalities? Don't worry if you don't, because it's a normal chest X-ray. There's nothing in the chest X-ray. So what is the clinical syndrome? So the clinic, like every time you have a case in any branch of clinical medicine, make a clinical diagnosis. Okay. So the clinical diagnosis is prolonged fever in a patient, minimal abdominal symptoms and no localization. And then based upon that, you try to form certain differential diagnosis. Now, can this be a PUO? Now, there is a tendency among all of us to write whatever fever that presents to us, maybe which lasting for like more than 2 weeks or 3 weeks as PUO. Now, PUO cannot be defined that way. PUO has a definite definition. So, the PUO, to be called as PUO, there should be a fever of 101 on at least 2 occasions, more than or equal to. The illness duration should be more than or equal to 3 weeks. And there is no non-immunocompromised state as well. Okay, so this is a classical PUO. And the diagnosis remains uncertain after a thorough history taking, physical examination, and the following obligatory investigations. So there are a set of investigations. Previously, they say you have to admit the patient and investigate for a particular duration of time to call it as PUO. That has changed now because most of our patients are actually evaluated on the OPD basis also. So IP evaluation is not a must to call it as PUO. So any patient who has fever more than 101, 2 occasions, and the illness lasting more than 3 weeks and non-immunocompromised, okay, And after history taking physical examination and the following basic test, if you don't have a diagnosis, you call it as PUO. So that includes ESR, CRP, TCDC, platelet count, hemoglobin, electrolytes, creatinine, total protein, alkaline phosphatase, alanine aminotransferase, aspartate aminotransferase, LDH, creatine kinase, ferritin, anti-nuclear antibodies, rheumatoid factor, serum protein electrophoresis, urine analysis, blood culture, urine culture, chest X-ray, abdominal ultrasound, tubercular skill test or interferon gamma release assay. So these are the minimum amount of investigation that should be done before you call fever as PUO. Now what do we have? Here the duration of fever is only around 12 days, okay, and we have not done all the investigation, so you cannot call it as a pyrexia of unknown origin. So it's a prolonged fever but not a PUO.